enhance our expertise, enhance our knowledge, and to commit to the sort of rules of the academy. That
I wanted to see if Mosley introduced him.
Sorry, Mark. We're muting Dr. Pett. So he's very excited. Go ahead, Dr. Lincoln.
No, so just in conclusion, this is part of what makes us great as a university-based health system, and part of a preeminent state medical school. The grand rounds in the Department of Internal Medicine have always set the standard, and in large part that's due to the time, effort, and attention of our faculty. I'd particularly like to give an item of quality to Joe and his commitment to this educational forum, and really delighted to introduce him today for our first grand rounds of the season. So Joe, thank you so much. Appreciate what you and Jennifer and everybody does to make this successful, and looking forward to a really great year. So Joe, take it away, please.
Thank you, Mark. Absolutely. And you'll see Mark and I are very kindred spirits, because there'll be a lot of themes in my opening talk that Mark has already touched on the history of medicine, and the richness of that is what I feel our department does a great job of. I think our grand rounds also does a great job of emphasizing that richness. So the Fun Empire Strikes Back for the Joy of Internal Medicine. It's the second in a series similar to the Empire Strikes Back. And our goals for today is to recognize some of the oddities and some trivial facts of internal medicine education as we kick off this great academic year of grand rounds that give internal medicine its unique nature. Going to help you with the creation of drawers of filing cabinet of internal medicine knowledge, so that you can skillfully and joyfully approach learning the material that encompasses internal medicine. I also want you to maintain that humility that it takes to approach internal medicine in most complete fashion, and also seeing some of the humorous sides. And we'll talk about how humor plays such a big role in learning. And we're going to work on developing that love for the discipline of internal medicine that will help you to keep coming back to learning without anybody having to tell you to do it, because that's what the love for a field is. No disclosures, and again, kickoff words on grand rounds. Again, today is the kickoff of the NFL season, and as I said at morning report today at the VA, this is, I feel, as exciting because we have a great grand rounds year going forward. We're going to get some great speakers here from outside institutions, as well as those from within our own institution. So some icebreakers. Not far from here, just about 30 yards away, we had the first internal medicine faculty photo of 1978-79 year. And you see about 5 rows in, five from the left was our founding chair, Dr. Roy Benke. You can already see his gregarious standing, even when he stand and smiled, he had that gregarious presence. To the left of him, the shorter guy with big sideburns, that's Dr. Alan Goldman. And Dr. Goldman, ironically, would become the second chair of internal medicine. If you look way to the right on that first row, the last figure you see pictured there is actually Dr. Patrick Brady, still an active member of our GI staff here, wearing classic 1978 decor. As you got to check out the pants that he has. Hopefully Dr. Brady still has those pants. He's in incredible shape, great fit. So they probably still fit if he still has them. Dr. Altus is right next to him to the right, and he comes and does guest lectures, and we'll be doing grand rounds in 2 weeks. And a little bit if you look all the way to the back row, second from your left, as you're looking at it, from the bearded gentleman, that's Dr. Dan Schwartz with flowing hair of the 70s. Dr. Schwartz is still an active member in our pulmonary department here at USF, centered mostly out of the VA. So this really shows, this is the founding spirits. This is the ingredients that kicked off what is the fantastic nature of this department. And these are the faculty members, many of them who drew me here as an applying medical student from the University of Florida. So Dr. Mosley had some of this in his opening email out, welcome to the entire department. And I want to hit on these factors and add a little more. What drives the best educators and learners? A positive energy, an exuberant smile with animation. You are ready to learn. You're taking the posture of ready to accept knowledge. Humility, because this is an incredible field that we're trying to learn And if we don't approach it with humility, we will gloss over some of the deeper aspects that we need to learn to be great physicians. Humor is extremely important, as I will point out. And something our Dean Lockwood, really hits on is grit and resiliency, what I call the hustle factor for learning. So this is my first faculty photo. So right from the beginning, animation, as you see, the arms are moving. And if you say, geez, Lezama really hasn't changed from that picture 24 years ago, well, that's what I want to do to you. I want to imprint you such that you don't change for the rest of your career. Right? There's something bad here. Oh, there we go. There we go. The other thing is, this is my volunteer. So what do I do for humility? This is my volunteer badge, very first badge that I had at Shands Hospital. And this badge is a reminder for me of where my journey has come from. To never get my head to be too big, to always respect every college student, every medical student, every intern, to respect where they are in their journey. Because this is where I started in my journey. And then humor also, and as Dr. Mosley wrote, being a little vulnerable as a leader, so being able to take some good humor. So everybody knows my love for Mountain Dew. So the residents were in on this one April Fool's, where they made sure that I knew that they loved my humor and my attention by lining my entire door with Mountain Dew. So, and my staff has that bobblehead that you see there, Run, Lezama, Run. So those are some of the things that you open yourself up to your staff, your residents, as an educator. I think that's what you'll find in us in our Department of Internal Medicine, as well as donning the Matrix sunglasses for a board review. And where I got my example was from my heroes. So Dr. Gonzalez-Rothi and Dr. Jay Lynch for the University of Florida really showed me that modeling. And what I hope is that you will find models like myself and others in our department, and I think you will, who will help you to guide you in that journey. And here's the hustle factor. This is the award I'm most proudest of for two reasons. One, it's the embodiment of everything that I am. I'm about hustle. I'm about work ethic. I'm about, if I can't figure it out the first time, I will figure it out the second time, and I'll do it the best the third and fourth time. That's the approach you really want to go with this. The other reason I'm proud of this is the runner-up for this award from Northside Little League was Kevin Cash, the manager of the Rays. So that's my only MLB moment that I can state and brag. And Kevin, though, Kevin Cash was able to go to the Northside, to the Little League World Series about 6 years later, so I wasn't able to do that. But speaking of baseball, this is the way I view internal medicine. The way to approach it is like a baseball box score. It can be really alarming at first when you look at this, but if you do those drawers of filing cabinets, like we will talk about, if you approach it with a love and with the hustle, all these things will start lining up for you as if, that's okay, I can handle infectious diseases, that's a catcher on the team, I got this. Endocrinology is kind of out there, that's why I put it in left field. We always say things in left field are out there. There's some stuff in endocrinology like cyclical Cushing's disease, which I got to experience with my wife who had that, which that's a humbling disease to try to learn and stay on top of and diagnose. And my apologies to rheumatology and allergy for putting them in a first base platoon. I was just running out of positions, but it falls in the immunology world. So now, speaking of scores, here's our 3-year pass rate for internal medicine ABIM, 98.3. And if you go, that looks pretty good. Oh yeah, that looks really good. This is the Sweet 15 of ABIM 98% plus in the US, where there are over 444 internal medicine residents. So for programs with at least 12 students, 12 residents taking the test, these are the only 15 that got a 98% plus 3-year pass rate. And you will notice there's a big Boston contingent with Beth Israel, Boston University, and Tufts, and Albert Einstein, Mayo. But look at the list. I never speak badly of any programs, but just take a pause to see who's not on the list. And take a pause to say, sometimes when you say, what is an elite program? I want you to say you are in an elite program. This is an AAU research designated university. And this is one of many points of evidence of the incredible nature of the program and the Department of Internal Medicine that you are in. And actually, if you go back a couple of years, you'll see different names up there. If we looked at this 2 years back, but two of the names that would still be there would be USF and the Mayo Clinic. So we are also staunch, determined. We have resiliency that we remain in place. I love it. And also, we have won 7 Jeopardy titles in the last 19 years. This is a big deal. If you want to see people like elbow and try to take out people's knees, just watch an ACP Jeopardy competition. And that is saying something that out of 51 programs, we have 7 out of the last 19 titles in the state. And we are all about innovation, which you'll hear about today, but I wanted to shout out as we sort of conclude the celebration of the MedPeds, their 25th year anniversary. And I always say our success in internal medicine, our program is also from our medicine pediatrics residents. So I want to make sure that the medicine pediatrics residents, as Dr. Mosley said in his email message for all of us, you belong. You belong and you are outstanding. Actually, if you look at the board pass rate for MedPeds, you go back 15 years, it's 100%. So testament to Dr. Erica Abel, the program director. Dr. Altus was one of the kickoff members, and we have him featured there when we had the program. And then as you go through this presentation, see how many of these you would get as I go through. This is Dr. Petter and friends at the VA came up with this Lezama bingo, where you will see whether I reference the GI clinic or say in the mid-90s. Hopefully this grand rounds won't run over time because I'm keeping an eye on time in the real phone here. A CRP, youngest chief of medicine, something with big fat Greek wedding. We'll see if that holds up. Our UF reference you already have put on there. So boards you've already put on there. So, and we'll see if we see random microbiology. Again, medicine is an apprenticeship. The joy of internal medicine is storytelling, its environments, its history. And with teaching innovation, there are formal programs out there on teaching innovation. One of them being the Training to Teach program in Harvard, which delivers innovative teaching methods online over 6 months, both for a classroom setting and how to teach on the ICU and the wards. They talk about educational theories that hold true through the spectrum of learners, and they emphasize the skills of being an effective teacher and creating national contact, and a capstone project to be brought back to the home institution. So this is something that has been formalized, what we're doing here. Laughter as a form of teaching has been shown in numerous studies, Weimer, Stambor, Henderson, as you see up there, that as you use laughter, you stimulate creativity, you reduce stress, you motivate effort for goal-oriented processes and long-term memory, and you increase attention and interest levels. And why I've always used humor in all my teaching. And so with that, we have a season 2 renewal of Lezama, the series which runs in our award-winning Netflix streaming network. So forget about Ozarks or Emily in Paris or Cobra Kai. This is the series that you need to watch. And today we will have some trivia questions about the place of Tampa, because many of you all are new to Tampa. We have a lot of new staff to Tampa, so you'll enjoy those. So it's time for a rock concert. This is Metallica, so you can, on your bingo board, you got your 80s reference right from the start. So start with a trivia question. When was Tampa first incorporated as a formal town? And what was the military outpost where it sprouted from? It was actually Fort Brooke. And you're like, hey, I park at Fort Brooke. Yeah, that same garage right next to Camel's. That was, near there was the first military outpost. And in 1849, the first, we were called Tampa Town. And it wasn't until 1855 that we changed to actual Tampa. So the first episode in our Lezama is the origins of internal medicine, touching on the history that Dr. Mosley was speaking of. And internal medicine really was born out of François Bossuet de Sauvage. So I've been practicing a little bit my French, and that's not Sauvage by Dior. This is Sauvages, if you will. But this was the first description of disease symptoms. And this Sauvage wrote 32 works, which, by the way, you can buy one of them on Walmart.com. I did not know that. One of those binders you can buy on Walmart.com. But that was the beginning. But late Germany in the late 1800s, as Dr. Mosley talked on, Dr. Osler, was the beginning. Dr. Osler was a Toronto School of Medicine graduate, for those who don't know. He was from Canada. And he trained under Virchow for his post-grad training in Germany. And those physicians in Germany in the late 1800s were using lab data science to provide patient care rather than the usual exploratory surgery, anecdotal tales of medicine that were part of most of medicine up to that point without any testing many times of patients. And so internal medicine comes from innere Medizin. I'm not going to even try to go on that. I tried with the German Ich liebe dich. So inner, which means I love you, but innere Medizin, describing the movement of physicians in Germany that were using lab science with their physical exams to take care of patients. And so American physicians started flocking to Germany to learn these techniques. And internal medicine, and again, Osler, and you're going to see Osler is one of the big four founders of Johns Hopkins, along with Dr. Halsted. But internal medicine continues to grow after World War II when the NIH gets founded. About 4,000 board-certified internists exist in the post-World War II era. That's it. Now, 425,000 U.S. physicians have some type of certificate that's been issued in the past few years. And as I mentioned, Osler established the first residency and was the first teacher to take medical students out of the classroom and put them in a ward ICU setting. The GI Bill, post-World War II is where things started increasing in residencies, and only 6,000 total residencies were available in 1940. 6,200 just at USF. I'm just kidding. But there's a lot of residencies in it. You know, we have 125 spots here. Just think about there were only 6,000 total residency positions in internal medicine about 80 years ago. Our episode 2. So following that love. So last year we had the longest word. Well, how about the shortest word in medicine? So there's lots of ties, but I like this one, id, as an id reaction. And actually it was derived from dermatophid, but then it just grew to become just id. And it's acute dermatitis that develops days or even weeks at distant sites from the original insult. It's known as autoeczematization. Don't try to say that too fast. The interesting thing about this is that it usually avoids the trunk back, usually hits the hands, feet, extremities, face, but it's a reaction to some insult that comes first, whether it's infectious, like from a dermatophyte, or inflammatory, and it forms the site distant from that. And if you're treating somebody for a condition and you think the medication may have caused it, the actual literature states continue to treat the underlying condition and just deal with the id reaction with steroids or even methotrexate if you have to up the treatment. There we go. So how about in a word? Erythema ab igni, dropped in a word. That means redness from fire, from the Latin. Reaction from heating source, such as a traditional heating pad placed on an area of pain. It resembles lividoreticularis. Lividoreticularis is much more fine as opposed to erythema ab igni, much better demarcated rash. Why? I've got patients who say, I like the heating pad. The rash is kind of cool too. You can't keep putting the heating pad there or you're going to develop squamous cell cancer. So you have to educate your patients to stop that. And there's a picture of erythema ab igni. Now, what was last season's long word? In case you're like, what was that word? It's this pneumono-ultramicroscopic silicovolcaniosis. And I've been practicing that. My daughter actually has a little song from a cartoon where she could actually sing this. So this is the longest word in the English language from last year. And it is an interstitial lung disease due to exposure to volcano ash. So our third episode are diseases that have repetition, like New York, New York, that song, which in case you're wondering, was by Gerard Kenny from 1978. Last year we had Loa Loa, which is a Friday the 13th of your sclera of the eye. Loa Loa, of course, can be treated with diethylcarbamazine. It can also be treated with albendazole or ivermectin. But for your boards, diethylcarbamazine is the answer. Haley, not spelled like our hospital, is benign familial pemphigus. Itai, which means ouch, ouch, from last year. it's a painful osteomalacia from cadmium poisoning, and then moya, where you get internal carotid artery occlusion with collateral vessels, the puff of smoke. That was last year's, and there's a bad sclera day for you with Loa. And then this year, I like pseudo hypothyroidism. The reason I like this disease is because it's great for boards. So, and I like teaching you for boards, but it has some of the features of pseudo hypoparathyroidism, like short stature, round face, short bones of the hand, subcutaneous ossifications. But notice the calcium, phosphorus, and alk-phos are completely normal, and the PTH is normal. Because as you know, the thing that makes pseudo hypoparathyroidism so interesting is that the PTH is high, as opposed to regular hypoparathyroidism, where the PTH is low. And the way to remember that is hyperparathyroidism has a high PTH, so hypoparathyroidism has a low PTH. And if you're going pseudo, your PTH is again going up high. This is trying to help you for those drawers, those filing cabinets of how you put your knowledge together with the great expanse of internal medicine to learn. And this disease tends to be from the GNAS gene, which again deals a lot with the alpha subunit of stimulatory G protein, less obesity and cognitive impairment. So some of these folks can lead fairly normal lives as opposed to pseudo hypoparathyroidism. And in fact, we've seen some patients who were labeled in medical, and I've seen it in medical grand rounds, labeled as pseudo hypoparathyroidism, and they explain how they were able to really break the myth on that and prove that they had pseudo hypoparathyroidism, which is a game changer for these folks' lives sometimes. But there's the stature, and you can see the short bones on X-ray. Our next episode, as we had from last year, is famous duos in medicine. There's your 80s reference times 2. Turner and Hooch. Tom Hanks, that's what he looked like in the 80s, and Hall & Oates before they were fighting with each other. But I had to bring this duo, which is my favorite duo of all time, is JD and Turk from Scrubs, which I think is the best medical series, combining humor and some lessons in compassion and empathy along the way. And where we always have to fear the janitor and what the janitor might be up to, right? That's part of the show. Many of these guys are still making commercials together. That's how beloved they are. So last year's honor roll was Shigeaki Higashi, Kikuchi Fujimoto, and Stevens Johnson's. This year, I like Machado Joseph because this is a disease that you need to recognize. Similar to Shigeaki Higashi, this is a disease that gets misdiagnosed as Parkinson's all the time. And if you have and why do we get a family history? Because if your ethnicity is from the Azores or Australia, you have a high incidence, a high rate of possibly having this disease if you're developing ataxia. In fact, on your boards, this is the answer to the most common cause of autosomal dominant cerebellar ataxia is Machado Joseph disease. Plummer-Vinson, I like, named after 2 Mayo Clinic physicians, because if you go across the pond, it's called Patterson-Brown-Kelly syndrome. So there's a competition versus what duo it should be named after. Esophageal webs, iron deficiency anemia, decreased contraction amplitude esophageal muscles. That's what you learn from textbooks. But I also want to give you the way you pick up on it on clinical medicine, angular stomatitis, colonychia, which is abnormalities in your nails, and glossitis. Though patients with Plummer-Vinson usually come with those symptoms earlier on than they develop these bigger ones. All right, so how about for episode 5 in our series? Low uric acid. Many of us don't order uric acid or phosphorus. And I'm going to show you how it can be so helpful. You're not sure if somebody has syndrome of inappropriate antidiuretic hormone, SIDH. One of the very helpful things is uric acid. It's markedly low in that state. Fanconi syndrome, which is important to recognize as part of type 2 RTA. And a lot of times this will be a early marker of impending multiple myeloma. So this might have you order POEMS and realize my phone was on. Order the SPEP UPEP. So POEMS is actually a variant of multiple myeloma where you're osteoblastic rather than osteoclastic. How's that for some humility, right? You're like, whoa, I thought for sure I had multiple myeloma figured out, and you do. It's an osteoclastic process, except for that 1% variant. And then medications. And I bring these up for one medication to bring up to you that is really helpful, and that's losartan. So losartan was found in heart failure patients to be really helpful in preventing hyperuricemia from cyclosporin. If you want to know the origins of how people figured out that losartan was so uricosuric, is because it was being used a lot in patients with heart failure with cyclosporin. And so that's the medication I would definitely have you remember in that ACE, ARB, statins, phenofibrate category. And for phosphorus, hypoparathyroidism, as we talked about, ischemic bowel sepsis, diabetic ketoacidosis, and rhabdo. Ischemic bowel can be a really nice early clue to look at that phosphorus level and go, something here is not right. All right, so we've done the first 5. So has it ever snowed in Tampa? And if so, when? So the answer is yes, only twice in records. February of 1899 and January of 1977. In January 1977, it actually snowed in Miami. That was an incredible, and that's the only time I think Miami in records has received snow. And that's not me, young Lezama. This is just a picture I took off where people commemorated the January 1977. I think we're due. I think we're due. We're due for snow. All right, episode 6, hair today, gone tomorrow. This is early alopecia onset warnings. So again, a lot of clinical medicine, drawers, filing cabinet, drawers of knowledge that I'm trying to help you with. You can pick up on some of these diseases very early, like hypothyroidism, lupus, both scarring and non-scarring, sarcoid, which has a classic hue appearance that I will show you, leprosy, and leprosy usually is mild because heat works against Mycobacteria leprae. So that's a cool fact. Syphilis, and I'll show you the moth-eaten appearance, and lymphoproliferative disorders. So this would be something where you want to look at the CBC. You want to maybe consider a flow cytometry if in doubt. What about hypothyroidism? So 11% of subclinical disease will have alopecia. That's why I told you it's so important to be on the lookout for that. About 78% of it is the telogen effluvium type. What does that mean? That means that that's as you brush your hair or as you take a shower, you see a lot of hair in the drain. That's the telogen effluvium. It signifies the point of hair synthesis where there is a pause in development, and that is in telogen. And then you can also see lateral loss of the eyebrow, originally described with Queen Anne, but there's a picture where you can see centrally how there is what looks to be a normal eyebrow and very, very dramatic thinning laterally. This is the moth-eaten appearance of syphilis. As you can see, if you look at it, you're like, oh yeah, I can kind of see a moth. But that's the best angle to take to look at the alopecia to see the moth-eaten, and then B is after treatment for syphilis. This is lupus alopecia of the discoid lupus type. Look at the follicular scarring and plugging on the right, and on the left you see more inflammation and the thinning of the hair because of the alopecia. And this is the typical hue that we see with sarcoid, where you can see the skin lesions with that orange, reddish hue, and the alopecia areas usually also have that orange, reddish hue. Now, episode 7, terms that are fun to say. Remember last year we had pityriasis lichenoides et varioliformis acuta. Don't try to say that too much. You'll get hypoxic. Of course, we had rhinitis medicamentosa, which I like to say rhinitis medicamentosa de caballo blanco con un grande cabeza de bala. So that's a shout out to all my Hispanic brethren out there who are, again, humor to help you remember things. So rhinitis medicamentosa, we think about aspirin, but alpha blockers and beta blockers are notorious for also doing this. And lentigo maligna melanoma, which I showed the pictures here. You don't ever want to miss one of these. And the patient might have that for 10, 15 years. So that was last year. This year, my favorite, I got to back up so I don't get spit on anyway, is diphyllobacterium latum. So you have to really practice to say it right. Diphyllobacterium latum. And this is the fish tapeworm. Low vitamin B12 is actually only seen in 40% of cases. So if you're looking for the B12 deficiency and it's not there and you say, well, it can't be a fish tapeworm, you are functioning under a fallacy. For boars, 1 dose of niclosamide. Just like diethylcarbamazine for Loa Loa, 1 dose of niclosamide for diethylbothrium lactam. All right, how about this one? Multicentric reticulohistiocytosis. You say it with enthusiasm. So these are brownish reddish papules over the DIPs, usually, but also the PIPs, as you're seeing there. And it's associated with aggressive DIP arthritis. But look at the internal malignancy association. You should not blow this off. A lot of folks are not aware. 1/4 of cases will be a premalignant condition. It will be something you need to look for: lung, stomach, cervix, breast, colon, and ovary. Usually for people who are at age to be screened, but maybe not, and you start using this disease as a reason to screen. And again, associated with other conditions noted there. Then there's Dejerine-Rouste syndrome. This is a post-thalamic pain syndrome, usually from the ventral posterolateral thalamus. And if you're like, well, that's for my neurology friends, there's named the lesion on the internal medicine boards. So in neurology, so you don't want to blow this off, but you want to learn this because it's fun and it's important. But it can occur anywhere. This lesion, anywhere where the spinal thalamic tract is affected, could be an issue, as you see there. It can develop even up to 10 years after the stroke. So keep that in mind in people who develop these painful, unexplained hemisensory syndromes, especially if they tell you that they're triggered by noise, taste perception, caffeine. This is why taking a great history, which is the art of internal medicine, is so important. And of course, blasto, which you got to say blasto the right way, broad-based budding blasto. And you'll never forget. I still have alumni that I run into the airport, and they go, Lezama. I go, hey, what's up? And he goes, I'll never forget, broad-based budding blasto. So never forget that. And they'll be coming back later. Episode 8, things that actually exist. So last year I had Charles Bonnet syndrome, where you can see hallucinations due to poor eyesight. This guy is not psychotic. He's seeing giant dogs on the road, and he has no underlying psychiatric illness. He just has horrible eyesight, and the brain substitutes images that are stored for the lack of any perception that's coming in. You actually grow out of this, believe it or not, you get used to your poor eyesight. This year's phytophotodermatitis, which you will have negative patch testing. If you if you say, oh, this Lyme caused it, you can patch test the Lyme, it won't be positive. It is Lyme-induced with the sun hitting the right affected skin. Look at these. So this is, be careful when you go on your next cruise. So Lezama is here, Dr. Lezama is here to maximize your cruise. This can be extremely painful, as my cousin found out during her trip to Puerto Vallarta. Ito cell. There actually is, and I call it Judge Ito cell hyperplasia. You'll see why in a second. But the Ito cell is the stellate cell. It's a fat storing cell. And it's a state of hyperplasia beyond the usual macrovesicular fat that sits in hepatocytes. And you got to think of inflammatory diseases, if you see this, such as adult onset juvenile rheumatoid arthritis. And so the real Judge Ito is this guy, and he was the judge during the O.J. Simpson case. And when I was a third-year medical student, the O.J. Simpson case started during that summer, and every room I went into, everybody was watching the O.J. Simpson case. It's almost like 20 years ago at the VA, from 11 to 12, with you were rounding, everybody was watching The Price is Right. So, in fact, when I got to the showcase, second showcase showdown, I knew I had to hurry. If I was in a room, I'm like, oh, geez, the second showcase showdown is there. I got to finish rounds to get to noon conference. How about papulous eustachian tube dysfunction? That sounds not real, but it is real. Patulous means persistent opening. It causes a roaring tinnitus and audible respiratory and cardiac sounds. That's called tympanophonia. And noise from an open eustachian tube directly transmits to the middle ear apparatus, causing this. It can be extremely annoying. Hyperacusis to regular sounds. When you lie down, symptoms improve because the eustachian tube starts to close. But you can't be, face down and walking. It's hard to do. Pregnancy, weight loss, caffeine, and radiation all can cause this. Surgery in extreme cases needs to be done. But a lot of times you treat this as kidney stones. You just tell people drink a lot of water, stay very hydrated, and it helps to, close that eustachian tube. So this, of course, is Michael Constantine, episode 9. He was Costas Gus Portocales in the great My Big Fat Greek Wedding movie series. And so Dapsone, why don't I call it the Windex of medicine? Look at all the things that you can use it, right? In the movie, Portocales use Windex for acne, use Windex to, help other skin conditions, to use Windex for everything. Leprosy, use with rifampicin, sometimes clofazimine. A little shout out to the atypical mycobacterial world and Dr. Canella. Toxoplasmosis prophylaxis, pneumocystis jirovecii prophylaxis, treatment for sweet syndrome, bullous pemphigoid, even bullous hemorrhagic disease. It has so many uses. The runners up to the Windex title, D-penicillamine, which can be used for acute Wilson's and RA, prazosin, not only for BPH, but also for Raynaud's phenomena, and also nightmares from PTSD. Doxycycline, this one was like right next to Dapsone, acne rosacea, folliculitis, and of course, Q fever, Vibrio, Lyme disease, ehrlichiosis. We could keep going. Like I said, if you run into a barn, you come out with 5 legs and 8 arms, you need to give that person doxycycline. So they've got any kind of strange infection. Doxy's likely the answer 80% of the time. And then ferrous sulfate, which can be used for telogen effluvium, even with normal iron levels, or ferritin levels, sorry. Restless legs, same thing. And iron deficiency anemia, of course, as we know. Our next trivia question. Have we ever had a category 3 hit? And this is a heads up that we are in hurricane season. Dr. Mosley will be very happy that I'm giving you this heads up. So yes, we have had only 2 hits. And one of them was before Tampa Town was even born. The Great Gale of 1848, which was 2 years after a much lesser one known as the Great Havana Storm of 1846. And 1921 October. This is our worst nightmare. This is the track likely of the 1848 hurricane. Supposedly, what you understand to know as Clearwater, St. Petersburg, and Tampa, Davis Island is shaped by that hurricane right there. That hurricane reshaped the landscape that is known as Tampa Bay. Pretty scary to think of that. Have your hurricane plan ready. And this is, in 2024 graphics, what the 1921 hurricane would look like. It was a direct hit on Tarpon Springs, but because it was so huge, you had an 11-foot storm surge on Bayshore Boulevard. 11 foot, think about that. So have your hurricane plan ready, guys. Episode 10, mirror, mirror. The opposite. So chronic eosinophilic pneumonia. It's the reversal of findings that we would see in CHF. We call it CHF photonegative picture. Open lung biopsy usually is needed for the definitive diagnosis. Steroids as the mainstay of treatment. Notice how peripheral those infiltrates are as opposed to sparing of the central area. Then a groin rash that's not tinea, not fungal, not inverse psoriasis, a bacterial infection. We usually don't think of bacteria in the groin, so that's why it's a mirror, sort of a reversal. Corynebacterium medicinum, also known as erythrasma. Topical erythromycin, again in the filing cabinets of knowledge. Erythrasma, erythromycin, they look alike, sound alike. Use that to learn. Or clindamycin, and then macrolide, oral macrolide therapy if no response. And guess what I'm showing there? The classic poor red fluorescence on Wood's lamp that you learned in 3rd grade, it seems like. Now, how about reversal of hot and cold of liquids and solid objects? Ciguatera, right? And we all know the fighting ciguateras are the mascot of the University of Puerto Rico School of Medicine. Right? The fighting ciguateras. So, and it's from the microalgae Gambierdiscus. Only 50% of the time, though, do you see the hot-cold reversal. It is the most common non-bacterial seafood illness. Great for boards. Great for boards. Ciguatera is the answer. It can cause paralysis and death. And where do you get ciguatera from? Barracuda, right? As Amber Pepper said last year, she sang the whole song. Barracuda. No, she just went barracuda. For heart, you see the moray eel on the bottom left. Abalone is to the middle, up. Amberjack there, and of course, what's that over there? That's sea bass from Dumb and Dumber. So that's the guy who played sea bass in the movie Dumb and Dumber. But sea bass also is a risk factor. How about hidradenitis suppurativa? It is a reversal of acne vulgaris. And actually, it should be termed acne inversa, but we call it hidradenitis suppurativa because it's such a cool term. Although it does affect the skin near the abrogant sweat glands, it really is an occlusion of hair follicles in intertriginous areas. And the defect in that follicular epithelium is what leads to the fistulas, abscesses, and scarring. Quick fire pickup on episode 11. That's Matt Olson of the Atlanta Braves. While he was with the Oakland A's, he had this injury. He swung the bat, dropped the bat, started shaking his hand. So you can impress your friends when you're with folks. And when that happens, that's representative of 2 to 4% of all carpal fractures. It's from gripping. It's because of poor blood flow in that area, and it is a hook of the hamate bone fracture. And this is to give you PTSD anatomy, lesson of Guyon's Canal and all the things of Guyon's Canal. You can close your eyes now, and I'll tell you when to open them again. So remember gross anatomy, our friends learning all this. So next one is shooting star medicine, is episode 12. When you wish upon a falling debris of a meteor, because that's what a shooting star is, right? It's not, a shooting star is not a star. It is debris of a meteor or a comet that's entering our atmosphere. So these are misnomers in medicine. And these are some of the classic misnomers. I'll go over a few. I'd just like you to look at it in a second. You know, the one I've already gone over in conferences this week is erythema chronica migrans, because it's an acute rash. So chronica really doesn't belong in there for Lyme disease. But tinea cruris is from Latin meaning of the leg, but that's not where we use the term tinea cruris. Lesser Trellat sign, although Lesser and Trellat did talk about angiomatosis and a higher cancer risk, it was Hollander who actually described the explosive septase in gastric cancer, but he doesn't get credit for it. And along those lines, the Auspitz sign of psoriasis was described by 5 physicians before Auspitz. And yet somehow Auspitz went out. Auspitz must have been very popular. So, all right, sebaceous cysts are keratin-filled cysts lined by epidermis. So they're not sebaceous, right? It should be called epidermal cysts. Adenoma sebaceum is a dermal fibrosis in tuberous sclerosis patients with vascular proliferation and dilation. So it should be called angiofibromas. It's not an adenoma. It has nothing to do with the sebaceum. And the only true pure collagen disorders are osteogenesis imperfecta and Ehlers-Danlos. Everything else actually involves elastin, involves glycoproteins, along with collagen. And this baby, for those who go, I know this one, congrats. They give you a second. This is a pyogenic granuloma, but it has nothing to do with infection. So it really should be called an inflammatory granuloma, not a pyogenic granuloma. All right, how about the X-Files for episode 13? Debuted in 1993, my freshman year of medical school. And constricted pericarditis, emphysematous gallbladder, pseudogout, and dish are great diseases that you can pick up off an X-ray. Look at constricted pericarditis. You can see, look at the lower heart border and that gorgeous calcification there, in case the patient has distant heart sounds, such that you can't hear the classic pericardial knock in diastole. Then here, look in the upper, what looks to be like a baby liver is actually the gallbladder. This is an actual case of a patient I had with emphysematous gallbladder. As soon as we saw this X-ray, I went to the surgeon and I said, he doesn't need to go to CT scan. He needs to go to the operating room. And indeed he did. This is the flowing calcifications of dish, which has to be through 4 contiguous vertebrae. But you pick up on this, there's a high risk of diabetes, and you should get an A1C in patients who you see with this finding. The next trivia question. What was the outcome of the first professional sports history in Tampa Bay history? The first professional season was actually a championship. Who would have thought, right? Tampa Bay, remember that from when the Rays and the Bucks and the Bolts were all winning? Our first, the 1975 Rowdies, a year before the winless Bucks, won the North American Soccer League, which was huge. Back then, they beat the Portland Timbers in a battle of 16-6 teams. And they were a kick in the grass, and there was the old Rowdies there. And of course, the next year, we got Steve Spurrier and the Bucks. Spurrier was the first Buccaneers quarterback, for those who don't know. And they didn't win a game until their 26th game of their second year. How about disease? Episode 14, the medical Z's. Zoonoses refers to any infection that goes from a non-human animal to an animal. It can be parasitic, it can be bacterial, it can be viral. Zymogram is how you measure hydrolytic enzymes. There are not a lot of Z's, but you can impress your friends with these are the medical Z's. Zollinger-Ellison, so Dr. Mosley will be very happy to hear. This is named after two Ohio State surgeons, Zollinger and Ellison, from the 1950s. And of course, reflex gastrinomas. Remember, gastrinomas are not just in the stomach. They can form in the small intestine, they can form in the pancreas. And then a zonular cataract, you'll love this. The zonular cataract comes from the zonule of Zinn, Z-I-N-N. So somebody was having a fun day with Z's that day. So I think it was Zinn who wanted to say, we're going to have a bunch of Z's. And this, you got to be careful with zonular cataracts because the lens integrity could go if not approached right by the surgeon. How about eosinophilia? There's an eosinophil. Episode 50, eosinophilia everywhere. Eosinophilic folliculitis, if you see this on biopsy, your first thought is HIV disease. And it's associated with other immunosuppression, but HIV disease is something to look out for eosinophilic folliculitis. Eosinophilic esophagitis, the classic trachealization of the esophagus that you see there. So the history usually is of an asthmatic or somebody with atopic dermatitis. And then look at that band in the middle of the arm. That is eosinophilic fasciitis. Corticosteroids usually treats this. Sometimes this can come after an exertional activity in somebody who's fairly dormant. So that's just why they always say, don't just jump into running 10 miles a day if you haven't been running. Now, how about episode 16, encounters of the bite kind? Alligators are notorious for Aeromonas, but also Citrobacter and Enterobacter. They love these on boards. Bear, grizzly, or black bear bite is Escherichia coli. Number one, E. coli. When in doubt, E. coli is there. You're going to go with E. coli usually. But Erwinia and Hafnia, which I don't know much about those guys. So, but now you know those for bear bites. Rabbits, Pasteurella multicida, much less tularemia. The hamster, tularemia, rabies, and one definitely to remember on your boards, lymphocytic choriomeningitis virus, just like you should think it is a meningo. It can even become a meningoencephalitis, but you should think of LCM in getting a history of folks who have hamsters. A coyote, which there are coyotes in the Tampa Bay area, for those who don't know. Well, one of my friends lives in Clearwater and took a picture of a coyote at a hotel he was visiting. He was not in the lounge, he was in the parking lot. But tularemia and rabies, and then platypus, the bite is not, the platypus bite really doesn't cause damage other than local trauma, but it's the venom that comes out of its spurs. And remember, a platypus is something that looks like a duck, it looks like an otter, you're not sure what to make out of it, that's a platypus. And for you that guys grew up, I grew up watching Phineas and Ferb on Disney with my kids, Perry the Platypus. That is the famous character that comes out of that. All right, well, we have a lot of Ohio State running here. There's actually beginnings of Ohio State. It's not just about Ohio State coming here. Sometimes Tampa to Ohio State occurs. So what coach from Ohio State in his first head coaching job in the city of Tampa? That was Earl Bruce, who was a very successful coach. Again, not as successful as some of the other Ohio State coaches, but he had his run of success there. University of Tampa had a football team before USF. Actually had a team from the 30s all the way to the 70s, but only went Division I for 4 years. It was too costly to continue, and the Buccaneers felt that there would be competition, so that's why they stopped. The Spartans were 10-2. They beat the University of Miami, which is not easy for some state schools to do. I hope USF does it against Miami, coming up in a few weeks. The number 9 team in the country. So this is a big deal. And other big sport moments, the first college football game ever broadcast on ESPN was from Tampa. It was a UF-UM game, ironically. We've had 5 Super Bowls, as you see there, and the Bucs are the only one who won a home stadium. And my first outing as a resident, as a PGY1, I'm a PGY 28 now, as a PGY1 was to the first ever USF football game, September 6, 1997. We had a lot of fun, and the Bulls won that game. Nailed it. Diseases beyond the cuticle, episode 17. I'm going to show you the pictures in the interest of time. Terry's nails, which will go back here. There we go. Terry's nails, as you find here, liver disease. So think about washed out. Try to think in those drawers of filing cabinets that you're doing, like alcohol washing out. That helps you remember that the washout of the nails is Terry's nails. As opposed to Lindsay nails, which you see more with renal disease, the half and half nails. Maybe you think about in end-stage renal disease, dialysis is half the week. Maybe that helps you to remember half and half nails for renal disease. The next episode is called Shades of Medicine. And the shades of medicine include alkaptonuria, pigmented villonodular synovitis, which is a giant cell tumor of the tenosynovium, and Whipple's. Whipple's is the only classic malabsorption disease that pigments the skin. They're not sure exactly why. They think it might be due to B3, B12, or decreased cortisol, or maybe a combination of all three in that right space. Here's ochronosis of the eye, which is homogenetic oxidase deficiency. You can see the black spots in examining the eye and the sclera. And then don't forget, in the shades of medicine, broad-based budding, but with coloration. And that is chromoblastomycosis, and that's what it looks like. It's pretty cool, chromoblastomycosis. And, you know, a lot of times we need surgery to be able to treat this besides antifungal drugs. Almost to the end, the weather medicine. That's Jim Cantori. You never want to see this guy anywhere near you. Post-tsunami infections, like tsunami lung, melioidosis, which I'll go over. Unusual fungal infections happen after tsunamis. We saw that in Thailand in 2004. Migraines can be affected by barometric changes, so acetazolamide is useful as it is in menstrual migraines. Another great drug for menstrual migraines is topiramate, Topamax. And then hurricane sequela, which we see norovirus, Vibrio vulnificus after Ian in Florida, big rise in that. West Nile virus because of standing water with the mosquitoes. Dengue, similar. There was an MRSA cluster after Katrina. So you have to be on the lookout for community-acquired MRSA sometimes. In Puerto Rico, there was increased leptospirosis after, I think it was Hurricane Maria, and strep pyogenes with Harvey in Houston. But it gives you an idea of it's important to understand epidemiology because it changes your differential when you're dealing with post-disaster folks. And then tornadoes, even immunocompetent people after tornadoes, mucormycosis. Very important. Now, what's melioidosis is Burkholderia pseudomyeli, gram-negative, notorious for pneumonia, skin abscesses, and sepsis, and really endemic to both northern Thailand and Australia. And it mimics tuberculosis. Many times it's misdiagnosed tuberculosis. First-line treatment, third-generation cephalosporins such as Septaz, followed by several months of Septra. And then our final run here, which numbers I'll go pretty fast. Again, 3 is always the DIS number. You know, look at diabetic new line treatments, GLP-1, SGLT2, DPP-4, no 3. RTA skips 3 because RTA3 was found to really be normal. Even they can't round up in polycystic ovarian disease, right? And creatinine 3 down and out, all right? So 3 is just got no role in medicine, geez. I already said the number of internal medicine residencies we're going to count down. 95 is the sensitivity of U1 RMP for mixed connective tissue disease. 90 is the percentage of patients with Wilson's with a low ceruloplasmin level, which means 10% have normal. So don't discount Wilson's just on ceruloplasmin. 81.1, the expectancy of women in the US now with men being lower at 76.1. 50, the percentage of people with SCLE who are likely going to go on a full-blown lupus. And then 50 is the percentage of heart failure that's diastolic heart failure, which is really scary because most of diastolic heart failure we can prevent by control of hypertension. Now, this is really scary. From AMA 2021, 46.7% of physicians are above age 55, and we're having burnout in younger physicians. Folks, we are headed for a crisis if we don't do something here. And we're going to have a wellness grand rounds later in the year. There's a speaker that I'm going to talk to Dr. Mosley, who's doing a lot of grant work in this area. I think it would be great to have him come speak. This is for you to book your colon cancer appointment now. Figure out what age you need to start screening for colon cancer and stick to it, because this is really scary that colon cancer is detected almost equally, stages 1 through 4, and this still holds true even years later. The percentage of patients with PMR who go on to temporal arteritis within 12-20 months is still 20%. 10% of finding cryoglobulinemia in chronic hep C infection, something from our GI friends. 5 is the risk for autoimmune cause of hypothyroidism in the world. 4 is the risk above 4 centimeters. You should remove an adrenal lesion, but first make sure it's not a field, because you need to pre-medicate with phenoxybenzamine or phentolamine. 2% is those patients with lupus have a negative ANA. So beware, if it clinically looks like lupus, ANA is negative, don't give up. And 1% is those estimated to have underlying RA, with 0.3%. We always worry about left main, but by the way, it's 0.3% of all stents. So it's good to have it, but you know, I always say, oh, I think it's left main. We got a 0.3% chance of that, but let's explore and see. So if you like this, USF Book of the Month Club is my book, Internal Medicine Learning, A to Z and 1, 2, 3. We were right behind Harrison's and Netterson. We say we because it really is a representation of USF Department of Internal Medicine. Even though I'm the solo author, I am the spokesman for all the greatness that is internal medicine here. And like I said, during most of the summer, we were in Amazon sales right behind Harrison's and Netters. Not bad company we're keeping. And so the challenge again, and I brought this here. So I throw the challenge flag to the faculty. I just threw the red flag, is to get beyond your point of complacency. Develop some pathway for innovative teaching, the way I have here, and bring it forward with a passion. Bring it forward. This is Dr. Tony, who made me into a comic book, but this is the superhero Lezama. Bring that superhero mentality to your residents and medical students. I also wanted to honor those faculty members who have passed, and you can see the list there, to include Dr. Edelman, Dr. Flannery, who started our board review here, Dr. Benke, our founding chair, H. Worth Boyce, William Boyd, and Jurgen Norden, GI, who were giants in the field of GI. Hussein Saba, giant in hematology. David Solomon owned Grand Rounds. David Solomon was the king of Grand Rounds. And so I want to thank my family, Maddie, Derek, and Caitlin, my kids, who always inspire me, my wife, Amy, that's me in the back. And thank you to Dr. Mosley for his support of Grand Rounds and our education mission here at USF. And I think today we have Touchdown Tampa Bay and Touchdown USF Internal Medicine. We're going to have a great year, and you guys are going to learn so much. I want you to know what special place this is, and we're going to fill you with so much knowledge. You're going to go like this, and just nuggets are going to fall out. I'll stop there, and I'll take any questions. Thank you. Questions? Comments? All right, so AMA says you have to have 20% of all your activities should be fun. I hope you had fun today. You learned. Probably there's about 125 medical facts I went over, and you didn't realize it. I fooled you. That's us as educators trying to fool you into you learning stuff that, learning is not boring. Teaching is not boring. Teaching is fun. So, anybody from online?
Just a lot.
All right, appreciate it. Thank you to my USF Internal Medicine family. Again, thanks to Dr. Mosley for the kind introduction. And we are very excited with Mark leading us forward as our new chair. Everyone have a great day. I'll see you very soon. For those at the Haley, I'll see you real soon. Take care. Make sure I don't walk off like